Hi, welcome to the coffee table. I'm Mina Malik Hussain and we have a wonderful show lined up for you today. As always, true to form. Today we're going to be talking about something pretty exciting, lasers. We're going to be talking about lasers, how the technology has developed, and because there seem to be so many cosmetic applications for lasers, not just shooting them into space, we have two wonderful dermatologists joining us today on the set to tell us about all the various procedures that are available, the risks, the kind of questions that you as the consumer should be asking, and how to be safe about everything. So we are delighted to be welcoming back on set Dr. Afshan Kalim, who is a consultant dermatologist, a cosmetologist, and a laser expert who's been practicing here in Lahore for 25 years, and Dr. Kamran Izhar, who also is a dermatologist, who has a diploma in aesthetic medicine, in facial anatomy, and a postgraduate diploma in clinical research from the University of Surrey. Welcome to the show, doctors.
Thank you so much.
Thanks for inviting us.
I'm always really excited when I have two guests on the set with me today, because usually it's just one person and a screen. That's not nice. I just half the fun.
Yeah, it'll make a good conversation when there are more people. Absolutely. And I'll be able to learn from both of you.
Yeah, and I learned so many things really from this show. It's been a real education, and I was like, wow.
These things are happening.
Exactly. Yeah. So let's start at the beginning, as it were. So, Dr. Qureshi, how has sort of laser technology developed over time? So, because I know that this is not necessarily a new technology, but it's been around for a while, but the applications have kind of changed with the development of the technology also.
Yeah, I mean, the laser has changed. It's evolved over the last 30-35 years, and it's become safer and safer as time has gone on and passed. And there's more research, more evidence available. From just hair removal to a lot of different things. And it's not just dermatology where laser is being used. Yes, laser is used in all kinds of medical procedures that are done, from cancers to a lot of other things.
Yeah, like LASIK for your eyes.
LASIK for the eye, and then there are other things, other applications for laser. And with time, it has evolved, and it has taught us a lot of things. And it has become more patient or client friendly, and it has become a more easier application, which used to be very painful at one time. Really? And I tell you, it was like you used to have a chiller on one side, and it used to be a very big machine. The first laser that came in was a machine big as size of a room. A small room.
Yeah. Like those really old computers also, now you're like these massive. Oh my God.
And then it has evolved to a thing with just 4 wheels and a small thing, chair side kind of a thing. From the cooling machines, which used to be put next to the laser, now they have self-cooling mechanisms and everything.
Nifty.
Yeah. So I think it has become, and there are two things always in one. You've told about the clinical research thing, so I normally talk from the research perspective also.
Yeah.
Whenever we're looking at something, first we have to establish the safety profile of the thing.
Quite right.
Okay. And then we go on to the efficacy. So all clinical trials which are done, whether it's a product or it's an application or a machine, they are first focused towards the safety, and then they move towards the efficacy.
Now, like you said, Dr. Qureshi, lasers used to be really painful and they were really tricky to use. And I imagine that a room-sized laser machine was quite horrible to operate also. So, Dr. Siddiqui, what are the kind of safety precautions or things that one should keep in mind when opting for any kind of sort of laser therapy?
No, the safety, the safety factor is for the person who's getting it done and for the person who's performing it as well. So the basic is the eye safety, because you need that eye goggle protectors. And then even the downtime has really decreased for the procedure.
So downtime means recovery time after the procedure?
And the actually doing time and the recovery time, both. So people can come for a lunch break and get the laser done and walk out of the laser. And go back to work. So it has improved a lot.
So how does the laser work? Like, what's the science in a laser?
The science is its rays, which attracts the pigment. So like in the hair laser, it attracts the pigment, which is how it works is that it attracts the pigment of the hair follicle. So it goes and work, and the pigment, the follicle is sitting the pigment cell is sitting in the hair follicle. So when it goes and attracts that, it kills the hair follicle.
Oh, nice. So it just sort of sucks it towards itself.
Yeah. Then it attracts the blood vessels which are present there. So the lasers which are there for blood vessels and also they just go and attract the blood vessels. And then they go and act on your connective tissue and elastic fibers. So that's how it's used in regeneration.
Cool. We're going to talk more about that. I want to cycle back to it. But I'm still sort of focusing on lasers itself because from what I understand, lasers are light. And it's like concentrated light that then, very simplistic term, burn things with it.
Yeah.
But that's true, isn't it?
That's the phenomenon.
Agreed with you. Laser is light, okay. Laser, everything has a wavelength.
Yes.
Yeah.
Okay. So now at different wavelengths, it behaves differently. The biggest safety concern with the laser is it can burn, as you said.
Yeah.
It can burn. And the user has to be trained enough that they know which area, how it is, which skin. Now, like if it's a fair-skinned person, they can take more energy in them.
Oh.
And if it's a darker skinned people, as Dr. Afshan said right now, that it is the black pigment which is attracting. Black pigment can be black,
like
brown.
darker pigment.
That is darker pigment. That is attracting the laser.
Oh.
So white is going to reflect it back. Black is going to take it in.
Absorb it.
Now, when black takes it in, so if it's a darker skinned person, there'll be more safety concerns which are there, and that will be one of the things. So different wavelengths, laser would be behaving differently. And then what is the therapeutic, when I say therapeutic indication, which means that why are we doing it?
Yeah.
If it's for hair removal, then it's different thing. If it is for some lesion like blood vessels or for any other lesions, even for mole removal, laser is used. Even for other kind of lesions, they can be, we can be using lasers for that. So it'll be different, but basic principle would remain more or less the same.
That's really interesting. And something else I also read about lasers in my notes is that because it's light, and light has a different, there's this sort of a color spectrum for light. You can adjust your laser according to the color of the thing you are targeting.
Yes.
So like you said, if we're looking at hair removal, then that means you can sort of set your laser to, seek and destroy dark colors. And then if you were treating, blood vessels, then that would be a red laser.
Yeah.
That's very cool. I thought that's super cool.
Actually, when the hair lasers came, the first hair laser which came was diode laser.
Yeah.
Right.
So it had a very short wavelength. So with the short wavelength, what was happening in our type of skin, in our Caucasian, not Caucasian, the Asian skins, then it would disturb the melanin which is present in the skin as well. So
because it wasn't able to kind of differentiate which...
and then people would get hyperpigmentation with it, and people would get redness with it. So, I know somebody, when we started hair laser, there was some very important person's daughter. She used to go to Germany to get a laser done, hair removal. They would do with that time, it was a diode laser. She would get all her body done there. And the energy that they were giving her was totally subclinical. And she would be spending like...
Oh, no. So subclinical means that it had no effect whatsoever.
Oh, not effect.
They were just zapping her with random lights.
And she would go there, stay there for 2 days, get it done, come back. Every month they would be doing that. So then it evolved, and then the YAG laser came.
Okay, what's that?
The YAG laser was another, it has a long wavelength.
Okay.
So it goes in, it penetrates, it penetrates the melanin which is present in the skin, and it goes and it attracts just the hair melanin.
Oh, so it's a much more kind of specialized and longer wave means that it can travel deeper. And not affecting. So that, really, it was a revolution of the laser at that time. And it was better for Asian type and type of skin and dark colored people's skin. So now what kind of lasers are we using?
All kinds.
Okay. So not diode. We don't use diode.
I use diode also.
Okay.
I use diode, and I think diode is, that's my own personal. Diode is one of the safest lasers which is there. Same.
Of course, if it's not subclinical, everything is fine.
But you use it with a certain wavelength for certain things.
Like Dr. Afshan is, she's an experienced person. She would know when she would see the patient. She would know that, okay, this is the client. I have to go with this kind of an approach, and like I would be working, so I would be knowing that this is. It's not just a matter of that I have this machine, so I would be. This would be the best machine. It is the doctor who would be. It's not that she has to do the laser. Her staff can do the laser, but she will be telling them what to do and how to do it.
Yes.
So I would think lasers shouldn't be done with the staff. I mean, somehow that's my personal thing.
Yeah. Okay.
I mean, you don't just leave it to the staff people to do the laser. You have to do it yourself.
Yeah.
You can't train. I mean, even a trained. I mean, I don't know. I mean, if a person is
going to talk back to this.
Come on that, and I'll give you my opinion on that as well.
In great detail, because I know that there are many feelings around it.
But see.
So it's a tailored approach.
It's a tailored approach.
It's a total tailored approach.
See, it's not one size fits all.
Yeah.
I cannot say that this is how this person is responding. At times we change the laser and see very good results. In my clinic, I see people are coming from different other clinics, and they're saying that, look, I've been getting lasers and I didn't get the results.
Yeah.
That doesn't mean that they didn't get the results. The problem is that they did get the results. The thing is, if there is a wall, there is a seepage behind it, and you are only treating the wall, not the seepage,
which is the root problem.
Which is the root problem. How are you expecting to get results out of it? That is a big problem, and this is why people should go to experienced and qualified doctors to be doing the thing. This is where I endorse what you said earlier, because it's not just doing the laser. It's not that laser is going to do a magic.
Yeah.
Magic is not.
There's no magic.
There's no magic here.
There's no magic.
Sorry to break it to you.
I tell my patients there's no magic wand here.
I tell them another thing. I say, I broke my magic wand a long time back.
Exactly.
So I'm sorry, I don't have it anymore. So till the time it's fixed.
It might look like magic, but it's not a laser.
It's not. It's not.
Magic.
It's not.
Nothing is magic in this world.
Darn it.
Yeah.
So, Dr. Siddiqui, I believe that there is a difference between ablative and non-ablative lasers. What is that?
The ablative lasers are where you're burning something.
Right.
Normally,
and there are instances where you do need to burn things.
No, but in cosmetic dermatology, you don't need to use ablative. Normally, you're using non-ablative.
No, if it is a scar revision, for example, that you need ablative laser. If it is a mole which needs to, then you're going for an ablative. If some lesion is to be treated, ablative laser. But if for hair removal,
or for regeneration.
Regeneration or rejuvenation is non-ablative.
Totally non-ablative.
Yes. And non-ablative are the ones with the longer wavelength also, because those are the ones that are sort of penetrating the skin deeper.
No.
Dr. Qureshi's like,
I'm just laughing on the thing because of the reason that may be a little more technical for the. We can talk on it a lot.
It's fine. We have a very sophisticated audience.
If you're removing a mole or you're removing a freckle, obviously you're going to burn it.
Yeah.
So you're using an ablative. So obviously when you're burning it, that's something different. But if you're doing regeneration and hair removal, you're using the other one.
So they're two different strategies.
Two different things.
I'll give you some names, like CO2 fractional is an ablative laser. Erbium ablative laser. Okay. But erbium can also be a non-ablative laser. Okay. So the thing is that it is how and for what objective that you're using it. Machines are different.
Right.
But now the beauty is that there are some machines which have been made like platform kind of machines. That's a new thing because in West mostly they're single room or 2 rooms based clinics. So they want a platform machine which can do multiple functions together.
Okay, so
So
platform is a sort
it
of
becomes
versatile.
easier. Yeah, it has more modalities, more functions in it. So platform machines are considered better.
Right.
But if you are looking at hair removal, rejuvenation, these are totally non-ablative.
Totally non-ablative.
Cool. We're going to take a very quick break here and come back to this fascinating laser conversation. Stay with us. Welcome back to the coffee table where we talk about lasers. And in my mind, I keep thinking of lasers that can shoot things into outer space. But these are really great civilized lasers which do all sorts of wonderful things. And we're talking to Dr. Afshan Siddiqui and Dr. Kamran Qureshi about all the things that lasers can do. So Dr. Siddiqui, a lot of laser technology has cosmetic uses. And in both of your practices, you guys are using lasers for a lot of cosmetic therapies. So,
Regeneration.
So we've been talking about hair removal and regeneration. So that's skin
Regeneration.
Rejuvenation
Of the skin. Regeneration of the skin is the people nowadays. Hair removal laser is now it's taken like it's norm now.
Yeah, everybody is
getting it.
And now you can get these tiny home devices also to sort of laser your own self.
Okay.
Yeah.
Dr. Qureshi's like,
we'll talk about that. No.
Again, I mean, they are.
I'm a big fan of those devices. Personally, I'm a big fan of those devices. But why? How? I say that okay, if you've gotten your lasers done in a clinic, and afterwards, if you are having these devices, IPL. Okay, now IPL is not classically a laser.
Yeah.
It is intense pulse light.
Okay, so it's not a laser.
This is not a laser.
Intense pulse light. Okay.
So again, you said that those are also light, but this is intense pulse light.
Exactly.
So this is safer. But it can also do burn.
Yes, so if you're doing it at home, you should use it with caution and preferably after a professional laser treatment.
Actually, the thing is, even with hair laser, you can't be hairless.
No.
There's no concept of being hairless.
Please tell us why you can't be hairless, because a lot of people are obsessed with being hairless. And they think it's possible.
But it's not possible.
So for the audience out there, it's not possible. It's okay to be a bit hairy.
Because the small hair or the lighter hair, they don't go away. So people who've got their laser sessions done, and then they can, if they need it, they can use these. And they are intense pulse light, so they don't, they have a very small frequency. They can burn those hair follicles.
Which are
lighter hair follicles, which we cannot burn it with a YAG or with a diode and all that. Because then they're left with such a small hair follicle. The size of the hair follicle is so small, and the hair, because there's a very thin hair which is coming out from there.
So what happens when, for example, for hair removal and you use a laser? Then what is one doing?
Basically, we're burning the thick hairs.
Right.
People come to you. They say we need to get a threading done or waxing done every week, every 10 days. So you don't want that to happen.
Right.
Now, again, firstly, you have to check their hormonal profile. So you just can't, if you have an abnormal hormonal profile and if you're getting the lasers done, you won't get those results. So you have to get your basic hormonal profile done. And if you see that there's some problem over there, then you need to treat it.
Yes.
And then go for the hair follicle.
Which is the wall and seepage example here.
Exactly. Because you need to treat those things and then go for lasers. Even if you're doing the lasers and the problems are there, it won't help you.
Yeah.
And it will, again, then people will say, okay, if we address that problem, then the hair will go. No. Because the hair which is grown, it won't go. You need to get a laser treatment done. So then you go for that.
Right.
And then people, instead of getting the threading done within a month, within 7 days, 10 days, they'll say, okay, our hairs are all right for a month now. It's a longer gap.
So Dr. Qureshi, what we're doing is that the laser is zapping the hair follicle and basically killing it.
Yeah.
And then the hair falls out.
So, I'll just add.
Ideally.
So what Dr. Siddiqui said, I'll just add a little into it. When let's say you've come to me in my clinic and you'd say that, okay, I want to get a laser done.
Yeah.
And I say, look here, what options do you carry? You say, I have wax, I've got threading, I've got razor, and these are, or I use a bleach.
Yeah.
These are the options that you carry. So, okay, these are the options that you carry. Now, let's talk about laser. Now, when there is a black hair in the follicle, so what it is doing is black is, as we discussed earlier, is taking the energy in, and the idea is it'll burst the follicle.
Okay.
Literally
zapping it.
Yeah, literally zapping it. But it may not do it.
Again, it can't do it immediately.
Yeah, it not immediately. So it has to be done in sessions.
Okay, so one session is not going to explode
No,
it.
it's not. So there'll be a 15%, 10%, 15%, or the hair may become thin, as Dr. Siddiqui said. Now, when the hair becomes thin, it stops because it is less black in it.
Yes.
Attracting less energy. That energy may not be enough to do any damage to the hair. We cannot increase the energy, because if we increase energy, we have a risk of burning the skin. Okay. Here, the laser becomes different.
Oh.
So instead of the long wavelength lasers, we have to go into a shorter wavelength laser. And shorter wavelength laser has a problem of burning the skin. So you have to be very careful. And that is where there are other lasers, like there are erbium and other kind of lasers which are there, which can be used, and then you can go for going with the fine hair.
For fine hairs.
And that is why there are triple wavelength lasers available now. Some companies have made these triple wavelength lasers which are addressing also the finer hair.
Right.
Now, this is the thing which we are saying. But now coming back to the consult which I'm doing, and I say that these are the options that you carry. Okay, when you wax, you are doing trauma to your skin.
Oh.
Because
Obviously,
when you're putting wax, when you're pulling it,
peeling off skin layers with it.
the end result of that, which develops over the time, is in our population mostly is post-inflammatory hyperpigmentation. Post-inflammatory hyperpigmentation, damage, injury, which is micro-injury. You cannot see it with the naked eye.
And then hyperpigmentation means that your skin
pigment is
darker,
getting darker.
darker then. Okay.
That's why, people come and they say we have darker hair.
Darker hair. Then threading also is doing
trauma.
Oh my God.
Threading is also doing trauma.
Exactly.
Because it is doing again the same thing, which is trauma, which is leading to post-inflammatory hyperpigmentation. If you look at women, you will see that this area where they're getting threading done, that is a different color, darker, sometimes a greenish kind of a color. And most of the women here in are malnourished and have iron deficiency. And that is also triggering or is playing a role as far as this pigmentation is concerned.
How? What does iron have to do with pigmentation?
Pigment which is present is visible more easily. And as you're getting threading done every month, so you're giving a trauma to the pigment. So the pigment becomes more, and because you're
just generally paler, the contrast
pigment is
higher.
more visible.
So if you have a wound and you are scratching it every day, it will not be healing and it will leave a mark. So it is same here. Now,
Good gosh!
2 options. The third option is using a razor. Again, razor is not as damaging.
Safest.
Safest. People think otherwise.
People think otherwise.
Exactly. People think that the razors are the worst.
Halaki razors, I think it's the best possible thing that you can do.
Okay.
I mean,
That's great.
Why
And it's also
people think,
painless.
painless.
why people think is they say, can more hair grows? The problem is when you do the razor, it takes away the hair from the surface of the skin.
Right. You're just chopping off the tip.
So obviously its growth is much, it will pop up more easily in fewer days than if you're getting a threading or a waxing done. Because then the hair comes out from the
But coming back to lasers.
So now just one. So now what is left now?
Yes.
The laser.
Yes.
The safest. And I can say it with evidence.
No, it is the safest.
Out of all these options,
it's
laser is the safest.
It's the safest.
Safest.
You need 6 to 8 sittings.
Yes.
And you're pretty done with
comfortable,
it. You're comfortable with
Yeah.
it. Because I mean, it's not. And then again, people think that they're, because you know, when the lasers came, I think this is 94, 95 when I came back after doing my post graduation. When the lasers came, it was advertised wrongly. Get a laser, get rid of your hair, get a laser done. Forever. Forever. So that, I mean, people thought give one session and everything is gone and you'll be hairless.
Yeah.
But
So
it
when,
happens, ma'am, one thing which you've seen, I've seen in my practice, with body hair,
I think body
it
hair
is a
very
totally
good.
different thing, situation.
Oh.
It is permanent.
Face
It
is different
permanent
and
at
body
times.
is, you have very good outcomes with the body.
The body maybe there are few things like axillary area, like your pubic area, because the hairs are stronger.
Oh.
You know, all the hairs are stronger. So in that, when you do the laser, they're gone.
Oh, wow.
You're done with.
So those are actually really, you
I
get good
encourage
results
people
there.
to get these areas rather than face, because people have an obsession for face hair. I don't know why.
That's true, but do you feel
Because
like it's...
you see it. You see it.
You
That's,
see it.
that's a reason.
But the thing is this, other areas are more difficult for you. So
But
it's
do you
better.
feel like facial hair has increased generally over time
Yes.
also?
Yes.
Because, you know, a lot of people have like hormonal deficiencies and imbalances are much more common
imbalances
now.
are much more common, and why they are common? Because the pesticides being used, and the quality of chicken and eggs that we are consuming, and the quality of oils that we are consuming,
Yeah.
and everything is wrong.
It is different because you see, we have seen it different, and not only that, chicken.
Eggs
One
and
thing which
chicken are
I've
the
never been
worst.
able to understand. That we've been talking about this chicken thing for so much time, but
nothing
still
has been done.
no one has been able to compile data and everything, because it's a big industry.
True.
No one has been able to collect any data on that,
Yes.
look here, what has happened. But you see, hair are hormone dependent. At times, post menopause, after somewhere is around in the 50, around the 50 age, at that time you are having a menopause. At that time, you see women are coming with hair growth. They've never had hair growth in their life, and they are coming at that
What
time.
a really inconvenient point in your life to suddenly have a beard.
So it
is
clearly,
happening, and it's not the hair growth; it's the cancer. Why is cancer increasing? But I don't know why people. I tell my patients, I tell them, "Okay, look, no chicken. If you want to have chicken, have desi chicken."
Yes. Ugh.
And have desi.
And where to get it from? Who knows? Anything. We're going to take a very
everything
quick
is
break
organic
here.
these days.
And come back to this very important conversation. Stay with us. Welcome back to the show. We're having a riveting conversation with doctors Afshan Siddiqui and Kamran Qureshi about lasers and all the cool things you can use them for. So before the break, we were talking in depth about hair removal and what to expect from that sort of laser treatment. And another big thing that lasers are used for is regeneration / rejuvenation.
Regeneration of the skin.
Rejuvenation.
That is the thing.
So how does that work? So you sort of,
It works.
what do you do? Like, what is it? So you use a laser and you plump up your skin, and what is the process?
The process is that these laser beams, what they do is they plump up your collagen and elastic fiber.
But how?
They sort of, the rays that go in,
How?
they help in plumping up the collagen and the elastic fibers. And when they plump up, obviously they plump up your skin.
Good.
And
that sounds great.
It is great.
Yeah, and then fine lines.
It works for the fine lines and wrinkles and all. But the thing is, again, when you get it done, it's not a magic mind. When you get it done, you need, whether you're using a fractional laser or a CO2 laser, you need downtime.
Yeah.
You need to be away in your room for 10 days. For nowadays, it's very easy because of COVID. You can be in your room as long as you like.
I tell them your mask is going to help you, and they say yes, that's a good thing. Okay.
So you need that time to because that's the time it takes. Because obviously, as we were talking about, it plumps up your skin, collagen and elastic fiber, but also has an effect on your blood vessels. So the skin do become red and raw a little.
Right. So downtime it's important. Aftercare is just as important, but
more important than getting the.
But then there's also pre-care, like before the procedure, Dr. Qureshi. I believe that there are things that one should be doing before getting any kind of laser treatment as well. That often doesn't happen.
That's the most unfortunate thing, because what I've seen ever since I've been practicing aesthetics mostly, that we have forgotten about preconditioning the skin before doing any procedure. Now, preconditioning the skin is very, very important, and that is what is not being done. Because when someone enters into an aesthetic setup, I'm not saying clinic, aesthetic setup. Why I'm saying so? Because right now there's a big thing going on, whether who can do aesthetics, who cannot do aesthetics, clinics, doctors, non-doctors. I tell you, all doctors, alhamdulillah, if not all, 90% of them have a very professional and ethical approach towards doing things.
Okay, that's good.
But most of the places which are non-doctor based, they do have this problem that what is happening is that once one enters into the place, we just want that they walk out getting a procedure done.
Right.
So that is where the preconditioning, because if I tell someone that go home and precondition your skin for 3 weeks, at least 3 weeks preconditioning is required for any major procedure to be done. 3 weeks. Yes.
So what does preconditioning require?
Preconditioning means that you have to put those melanocytes, those pigment producing cells off to sleep.
Oh.
And according to the procedure, again, it may vary from according to the procedure.
According to the books, which is written there.
So now if I want to get a peel done, or I want to get a laser done, I want to get anything done, I need to precondition my skin. And that is, and if I don't, and people want that I have come. It's not
you just walk in and walk out.
And walk out.
And you need to do that.
Yeah.
So that is very important.
So if your esthetician or your doctor is not telling you to precondition your skin, you should be asking about that. Hey, why aren't you doing this?
Exactly.
Yeah. And they have a right to know.
Yeah.
Some procedures don't require any preconditioning. They can be done right away. Like skin rejuvenation, Dr. Afshan was talking about, and she said, now skin rejuvenation again, whether it's being done with an intense pulse light, the IPL laser, that does very nice skin rejuvenation. And most of the skin rejuvenation procedures, which are lunchtime procedures, are these IPL procedures.
And they're much milder. They're much milder.
So they won't last you for a long time.
But then also you don't have to do a lot of preconditioning before.
You just go in, get it done.
There are two other lasers here, which is the Q switch and the pico laser. They also help in rejuvenation. Now, if I want to treat the pigment, which is in your skin, then I have to go with Q switch, pico, even IPL works in pigmentation. And it has wonderful results which are shown as such.
And this is quite complex, which is also why it's probably important to understand who is doing your procedure.
That's very important. That's very important.
So Dr. Siddiqui, what kind of qualifications should a person be looking for when one goes to, again, clinic or aesthetic setup? Like, there is a difference there.
There is a difference between that. So, I mean, a clinic where you know that there's a qualified doctor sitting there, and if he has that machine, he's been trained by the person who, or the distributor who has, I mean, but his training will be a lot different than a person who's not a doctor. Because he won't know the anatomy of the whole thing.
Because there are aestheticians who are not doctors.
Yes.
Who are doing lasers on people.
Exactly. But I mean, they can say, okay, yes, the distributor came and he trained us. Yeah. Because they all, I mean, everything is there for them. But they don't know the basic anatomy and physiology of the person. Of the patient, so I mean, they don't have the basic knowledge to get that type of a training.
So it's not just knowing how to use the machine; it's understanding
the person's, I mean, skin, their types, and their other medical conditions.
And the books, the books.
I mean, the person is diabetic, and if you do a procedure, and then if there's a complication, there's like a infection, what do you do?
Because diabetics take longer to heal, don't they?
They take a longer time to heal.
You're
intelligent.
You're good.
This show has taught me so much.
Okay. I'll just put my take on this thing. I think that, yes, it's very important. Now, you have to remember that most of the people or even the doctors who are doing laser procedures have been trained by that machine company, and it's on that specific laser. Okay. Now, what is happening? That if I have 5 machines, I've been trained on those 5 machines. But there are independent laser certification courses internationally which are there, which teach you about the technology, about the different wavelengths of lasers, how laser can be used, and a lot of other things. Unfortunately, again, in our curriculum, as far as medicine or other things are concerned, lasers are not taught as in taught. But what we understand better is the skin. We understand better is how the skin would be responding to what. And that is why what Dr. Afshan said, that we understand skin better. So we have an added advantage to have whomever is working there.
So one should be looking for a dermatologist who is also trained in lasers.
Who is trained in lasers, one. Okay. The other thing is, internationally even, see, international system is a little different. It's all insurance coverage. If I'm doing something goes wrong, my insurance needs to back me because there you need to go into these certification programs, and when you are doing certification programs, you can do that.
That's an added incentive to make
That's an added advantage. Okay. Now, like in Dubai, you are working there, so that course has to be certified by the Dubai Health Authority.
Regulatory body.
Under the guidance of a doctor, there may be trained technicians, laser technicians who are working, and those laser technicians need to have some, like in my clinic, every girl who's working is a qualified nurse.
Okay, so they do have a medical training.
All are qualified nurses. Qualified. They work in different hospitals also.
These are important questions to ask when you walk into a clinic
good,
like
if
that.
you have if you have a nurse, so again, a nurse would be having some understanding about the medical importance. So then when she can do it, she's doing under your supervision.
Yeah, if Dr. Afshan would be delegating her work to someone, she has trained that person and has that confidence that this person in my absence can do it.
Well, I don't do that.
But if you go to her, you will be in her hands, nobody else's.
No, I'm so scared. I do all procedures myself.
Agreed.
Which is great.
But
a good and cautious approach.
You have, but I still say lasers can be done by qualified people, not doctors. Laser is a job of a laser technician, and a laser technician has to be certified in that laser thing, which is not available in Pakistan. So then that becomes under the supervision of a doctor who knows what they are doing. It's not just buying a machine. It's not just buying a machine and doing that.
And I feel like in Pakistan, it's also a question of asking the right questions also, like as a consumer, like if one has a little bit of information, then you can go in and ask these questions and kind of find out, sort of what's the lowdown. Thank you so much.
The people come here, they want to get it done. They'll be sitting home for years, and suddenly today, they'll say, I want to get everything right. That's not possible.
But with preconditioning and with adequate visits, you can change your life.
But you have to educate them. And if I'm doing a peeling and I tell this patient, you have to use this product for 15 days and then you come back. I say, why? Why? Because you have to precondition your skin. You have to use 8 to 10% glycolic acid on your face for at least a week, 10 days, so that your skin gets used to it. Then only I will peel you with 30, 40 or 50% of glycolic
Listen to doctors, people. Thank you so much, both of you, for being on the show with me today. It's a fascinating conversation. You think of lasers and you're like, what could you talk about? And here we are.
A lot.
Having had this
we haven't covered everything.
Exactly. So much to say. I'm going to ask them, once we stop rolling, I have more questions. Thank you guys for watching. Remember to ask the right questions when it's a matter of your physical well-being and mental, but you know what I mean. Thank you guys for watching. If you're watching this on YouTube, don't forget to like and subscribe, and we will see you next time on the coffee table. Bye now.